Hello, everyone. I am Marie-Lise from True Mobility, and I'm here with Anne. She's actually been my midwife for the last two babies that I've had, hopefully just the two. But yes, hello, Anne. How are you doing?
Hello, I'm well. Hope everybody else is doing well in these difficult times and bad weather.
Yes, yes. It's not easy being in England and having COVID lockdown and having bad weather.
Yes, and having newborns.
True. So, Anne, would you tell me a little bit about your background? How long have you been a midwife? Things that you've seen during your midwifery, things like that.
Okay, so I've been a midwife for about 19 years. I did my education in Bournemouth, and then I've worked at Southampton, sort of like from qualifying. So, and I've worked in the community. I've also caseloaded HIV positive ladies. I'm a bit of an integrated midwife, so I look after antenatal women, postnatal women, labouring women, and I can do NIPEs on babies. So I only work 22 and a half hours a week. We do parent craft as well. So yeah, whatever the service requires, we go out to home births. Yeah, so
Yeah.
I cover the service quite well, I think.
Brilliant. Very, very, very covering. Well done. Now, just a question basically from a physio perspective, asking to a midwife, do you feel there's a gap between guidance and advice regarding the correct exercises during pregnancy and afterwards?
So I think we tend to. I think there's lots of advice out there, and it is definitely talked about. Whether we actually concentrate on it as one area, the trouble is we cover like the whole area of antenatal care, the whole area of postnatal care. So it is touched upon. I wouldn't say that we necessarily concentrate our time on it. Does that make sense? So
Yeah.
it is there, the support is there if there is a problem.
Okay. And do you feel there's enough people that would put their hand up and say, I need help, or do you think they need a bit more prompting?
So I personally think that they probably do need a bit more prompting. Okay, because actually not realizing the symptoms of requiring help, even if it's just because there's a scale, isn't there? There's a scale of treatment. There's your kind of, oh, just teetering on the edge of needing treatment, and then there's in the middle treatment, and then there's right at the end. And
Yeah.
very often, what we concentrate mostly on is the mid range to the end.
Yeah.
Does that make sense?
Yeah.
If
Yeah.
you've got a problem, you're going to report it because it's possibly embarrassing for you,
Hmm.
more than actually thinking you've got a problem and actually I can cope with that. Does that make sense?
Yeah, no, it definitely does. And being a mum myself, I think sometimes you just want to just cope with it and get on with it instead of kind of just
Yeah.
taking the time and actually
Yeah.
going, this is an issue. I need some proper help. Um,
Yes.
from your personal perspective and your professional opinion, do you feel a pregnant lady needs to be active during her pregnancy? And if so, why? What would be the benefit?
Active. So active with exercise.
Active exercise, active just in general.
Yeah.
Um,
Oh, yeah, I definitely believe that you theoretically you should be able to carry on as normal. I mean, there's going to be some activities that you can't do, but there's nothing wrong with walking. There is nothing wrong with swimming. Swimming is very good exercise, and also yoga as well.
yeah,
Especially, a teacher who specialises in pregnancy yoga. So yeah, and I think those people who were really active beforehand, um, I think it's important to maintain your regime of exercise until you feel that actually I can't do it anymore.
yeah.
And that will happen. That will happen.
Is that necessarily a point where you would say if you feel you can't do anymore that you should stop completely, or should you advise them to kind of seek something else they can do instead of, say, for instance, they were a triathlete, rather seek something else?
Yeah,
Um,
I think you can actually lower your kind of exercise regime to suit your needs at that point.
okay.
But there is no point in overexertion. You are developing a new, you're nurturing to come into the world a being. So, you know, I do believe in activity, but it has to be sensible activity.
Yeah.
And of course, it's good for you. The benefits are great, aren't they? You've got mobility, you've got burning calories, you know, for your mental health and well-being, it's a good thing.
And for the baby, what would you say is the benefits of being active and exercising during birth or during?
Well, I think, yeah, during the pregnancy, well, you've got the benefits of being active through the birth. It's going to help you through the birth. It's not going to be, hopefully, a traumatic birth for you, and therefore the transition into parenthood,
Yeah,
or you know, into birthing your baby is going to be easier.
brilliant.
Nutrition is the key to you know, sort of nurturing your baby inside you, really. And you know, exercise is going to, you know, help with that, really, isn't it?
Brilliant.
Can't think of
Now,
it. Can't think of
you say you see a lot of prenatal ladies. Can you see
Yeah,
a difference between a lady who is active and fit compared to one that is not?
yeah. I think there's definitely kind of how can I say, it's like, you know, the actual outlook on, you know, how you are, if that makes sense, looking after yourself. If you've got fitter ladies, and generally they are thinner, if I'm allowed to say that, and they're not gaining lots and lots of weight, very often, you know, I can't say that they have a better outcome because I don't have the research to say that, but they
True.
certainly do in pregnancy, you know, better.
Okay. And these ladies who you see as active and fit, when they come and see you, do you feel they complain less about, say, for instance, back pain or kind of pregnancy
Yeah,
related pain?
yeah. I think yes, I think you're right there. I think they do kind of, um, yes, they have less. Oh, this hurts, that type of thing.
Hmm. Now,
Yeah.
what are the most common issues that you have seen over the years in your practice in pregnant women that you believe could be solved through the correct physical exercises?
So we get a lot of lower back pain because of the weight of the baby, and our postures are really poor.
Yeah.
We get a lot of SPD, and you know, that's all. And you know, your joints are loosened, and if the baby's in the wrong position, and that kind of disrupts the, you know, your pelvic base, and that can sort of really be a problem for pregnant ladies. Again, you've got a whole wide spectrum of that. Some days it'll hurt, some days it won't.
Yeah.
Some women will need crutches, some won't need crutches. Okay. And of course, sleeping is a huge issue for these ladies because they just can't get comfortable, really. And actually, if they do get comfortable, then eventually that becomes sore, and then they have to move around, and that's all very, very sore as well. So
Yeah.
it's just very,
Yeah.
very uncomfortable.
Well, you've
So those
actually,
really,
yeah, you've actually touched on the next question that I wanted to ask about conditions that you feel would benefit from exercises. So you mentioned SPD, lower back pain. Any ladies with controlled blood pressure issues?
so I mean, so then the other thing is, some women will retain fluid, and you know, as part of the pregnancy. So how we kind of get that fluid back up and circulating around the body so that they're not, I don't know if we've got any tricks for that
Hmm.
up your sleeve. And of course, you've got the bladder, you know, sort of control as well. Some women who've had a lot, well, not a lot, maybe one or two children before, very often they will struggle with, you know, a little bit of incontinence through the pregnancy as well.
Yeah, I
So
think that's one of the big things that most ladies miss is if it's your first pregnancy, great, you've still got nice, good pelvic
yeah,
control.
so
But when it gets
other
to your
second
second and third, it's almost like if you haven't
again,
focused on it and if you haven't put the time in it, you are going to lose
yeah,
it.
yeah. And
And
actually, they've got the problems afterwards as well. So not only have you got you know, probably a few problems in pregnancy, you're going to get the problems afterwards, because after your first child, I always say nothing goes back after your second one.
yeah, yeah. And well, I think from my opinion as well is and personal experience that um, having the first child, uh, I don't think I was as zoomed in on doing the exercises and making sure that I keep myself as fit as I did with the second one. And I think I felt so much better after the second one compared to the first one, just because of the
Yeah,
fact that it was kind of, I was aware of the fact that I would need to be kind of focused on the pelvic floor. I think I was up and about much quicker than after the first one. I think the first one is a bit of a shock and you can't quite know, should I do it, should I not? Um, but I think that was the advice actually you gave me is when I saw you for my last visit, is you said to me, just make sure you focus on your pelvic floor because your second baby is a lot kind of stretchy. Things give a little bit quicker. So just make sure you kind of pick up on that. So that was good advice. Um, from your personal and professional opinion, any conditions you would not want ladies to exercise? So we might think of either placenta previa, preeclampsia, any conditions that you come to mind?
so I suppose you've got the cardiac conditions, haven't you, really?
Yeah.
So I've never been asked a question about exercising when you got preeclampsia. The trouble is, with a lot of the conditions, you actually feel quite unwell.
Yeah.
So you're not going to want to do a huge amount of activity, really, to be fair. And yeah, there are some conditions that are out of your control, like the placenta previa, where it covers the os. So you want to, yeah, I'm not, yeah. I mean, again, it would be interesting to see, if activity actually does, affect placenta previa, whether, it stays all intact. Does that make sense?
Yeah, it does make
But
sense.
yeah, I
I
mean,
do think there's a lack of research, and I think the biggest issue is more that just the fact that any lady is different from the previous one. Every
yeah,
pregnancy, even if it's
yeah,
your second pregnancy, is so much different than the first one. Um,
absolutely.
so I
Yeah,
do
you
definitely
can't.
think
Yeah,
we need a bit more research with regards to activity, as you said, and some of these conditions.
yeah. I mean, we would encourage activity for someone who's got a breech baby because actually it would help well, theoretically it should help with the rotation of the baby, actually, to be honest.
Yeah.
And if you
And
take that
speaking from
as an
personal
old,
experience again, remember
oh
I had a
yes,
bridge, yeah?
yes,
So
yes, yeah,
you
absolutely.
basically you listened to a heartbeat right underneath my xiphoid, so right underneath my chest bone. Um, and you just said to me, get moving, make sure that you move. Um, and stand on all fours and things like that. And she did turn
Yeah,
in the end. So
you did.
yeah.
Yeah, yeah, she did, didn't she? Yeah, little rascal.
But thank you so much for your time, Anne. I really appreciate it. It was lovely
Yeah.
speaking to you.
And
And
you?
then I will pick your brain on another time again if I can.
Okay,
Brilliant.
fine, good.
Take care.
Take care.